Hey guys, Tony here again. I want to answer a question that came in on the YouTube channel. So Bonnie was asking, quote, after rotator cuff surgery, parentheses, cuff tear, labral tear, arthroscopy with extensive debridement. So pretty significant surgery that Bonnie had. She was given a plain sling, no abduction pillow on it. My question is, why? Most videos I've looked at show individuals with an abduction sling, even a belt around their waist. Also, post-surgical instructions say sling as needed for comfort. Range of motion of your shoulder as tolerated. Seems questionable to me. Well, Bonnie, I agree. I'm going to tell you there's usually one of three scenarios going on here. So first, and it's unfortunate, but it's true, there might have been some confusion going on somewhere. The fact that you were detailed enough in your comment to specifically say cuff tear, labral tear, arthroscopy, it leads me to believe you're not the one that's being confused. So I have a feeling that somebody somewhere grabbed a sling that would have been normally given for a subacromial decompression or a less complex rotator or shoulder surgery, and you ended up getting it. The second option is they might not have had everything together. So maybe you got the sling, but you didn't get the abduction pillow. But that doesn't totally make sense either when you look at the instructions for, sling as needed for comfort. The last thing, the only other thing I can even imagine is certainly it's possible that you have an extremely progressive surgeon who doesn't believe you need the abduction pillow, who doesn't believe you should be immobilized for 4 to 6 weeks. That's certainly possible. We don't have any of those surgeons here in my area, but I have heard of surgeons like that, and I'll share a story about ACL reconstruction. So while ACL is a knee surgery, the original protocols for ACL rehab were super stringent, super strict until patients weren't following the original protocols. And what ended up happening was the patients who didn't follow the protocol actually did better than the patients who did. And so they created then an accelerated ACL protocol for the knee, which they would choose for the appropriate patient. So I would tell you that historically, I've never had a patient with a rotator cuff repair and labral tear who didn't come with an abduction pillow and 4 to 6 weeks of passive range only. But the only thing you can do is reach out to your surgeon, ask them specifically to clarify the orders and the post-surgical plan of care, because I would hate to see anybody doing things they're not supposed to be doing and put the surgery at risk for failure. But Bonnie, first, thank you so much for posting your comment. Anybody else on the channel watching, I can't give medical advice. The best I can do is share information and ideas that would apply to everybody watching. But if you have questions, please feel free to post them in the comments, and I'll do my best to get to all the questions as I see them. Otherwise, if you want to see the next video YouTube is recommending you watch, go ahead and click on this thumbnail right here. If you want to support the channel and help me reach more individuals, please click the subscribe button, and I'll catch you guys on the next video.